Welcome to the Thinking Practitioner Podcast,
a podcast where we dig into the fascinating issues, conditions, and quandaries in the massage and manual therapy world today.
I'm Whitney Lowe.
And I'm Til.
Welcome to the Thinking Practitioner.
The Thinking Practitioner Podcast is supported by ABMP, Associated Bodywork and Massage Professionals. ABMP membership gives professional practitioners like you a package including individual liability insurance, free continuing education, and quick reference apps, legislative advocacy, and much more.
ABMP CE courses, podcast, and Massage and Bodywork magazine always feature expert voices and new perspectives in the profession, including one from both Til and me. So Thinking Practitioner listeners can save on joining ABMP at abmp.com/thinking. Til, very good to have you back with me here today, sir. How are things going out there in Colorado?
They're going fine. Thank you. And thanks for the time off. It was good to have it. And it was fun to listen to what you're up to. You had some good conversations going.
Yeah, I had some fun things going with a number of different people there. And we do want to let you know that you were missed. So it's good to have you back. All right.
Nice.
All right.
And we have an interesting topic lined up for today. What are we talking about, Whitney?
Yeah, today we decided we're going to talk about changing our minds, essentially, is the big picture here. So the topic that we've got focused here today is reversals or perspective reversals, essentially meaning things that we've changed our perspective about from some time previously, either when we, first learned about things earlier on in our career, or, more recently, we might have been advocating or teaching or presenting things, and then we've changed our perspective and changed our mind. So we're going to talk a little about why we might have done that, what those things are about, and what happens when you change your perspective and change your mind on things. So,
yeah. And you invited me to share some of my top things that have changed my mind about or changed my perspective on. So I got a little list here. And then it's a fascinating topic because, well, it's really relevant to the world now because we have so many different opinions about things clashing with each other. And of course, each side wants the other to change their mind. And so that raises the question of, is that even possible? And when it happens, what makes that good or bad, and why people don't change their mind? I know that reflecting back on these topics, I had to think through a bunch of those things for myself. So I look forward to digging into that as well.
Yeah, well, I'm curious, like based on what you just said right there, what is it what convinces you, or what are sort of like in a more general sense, what makes you change your mind about something? Is it reading somebody's post on Facebook?
Facts, evidence. Yeah, what I'm saying with a smirk, because I like facts and I like evidence. I'm totally into that stuff. But I mean, the modern view and the research shows that it's not facts. It's not evidence that actually gets people to change their minds. Mm-hmm. It really isn't. It's some deeper, more mysterious process where what also emerges are biases or our proclivities or our things we already think true. We find evidence for that. But yeah, it's a mystery to me, actually, because we do change our minds. I certainly have.
Yeah.
And I haven't changed my mind about this topic yet, but give me enough time and I might.
Okay, right. Yeah.
But
I would assume probably it's some combination of those things too. I mean, joking aside, I think facts and evidence do play a role in that to some degree. Okay. They help shape our perspectives and help change some of the things to a certain degree. But I think, certainly saying that they are the sole piece of it is probably oversimplification.
Yeah. And I had a few arguments with people. They won. So I just totally changed the way I thought about things too. Mm-hmm. Not. Yeah. So that's the other thing that doesn't seem to happen, is that we don't seem to be very good at convincing each other to change our minds. But yet change happens. We do change our perspectives on things.
So you would not necessarily advocate for he who shouts loudest wins in their perspective is the one adopted.
It depends on how you define it as wins, but in terms of changing perspectives, no, not usually. Loudness doesn't really do that so much.
Right. Yeah. All right. Well, we'll try to keep it civil here today as we talk about those things that we've changed our mind about. All right. So where do we start looking at this?
Well, you gave me a little preview of your list. Can I invite you to share one? And I got some, I got to call you and raise you or whatever.
Sure. Yeah. So
across the table. Sure.
I'll start talking about in making this list and thinking about these things, I tried to think of like, what are some things that are more general and what are some things that are really specific? I'm going to start with a specific one on the top of my list here. And these are in no particular order, but they're just things that really came to mind. And this one has to do with thinking more deeply about physiological accuracy and understanding some more from applying, thoughts and facts and things like this. But early on, I was teaching a lot of things about specific massage techniques, such as broadening techniques where you go across the direction of a muscle fiber, for example, with large sweeping movements, or even more specific things with
cross fiber, or
of cross fiber applications. So and I was teaching a lot that what we're doing is sort of spreading muscle fibers apart, with our broad cross fiber applications, and helping enhance pliability of tissue by just making it more mobile through this spreading apart. And I think that also would kind of relate to what I taught early on about deep friction techniques, of breaking up scar tissue with tendon scars and things like that from friction techniques, separating those individual fibers with our pressure techniques.
So we got the broadening idea, and then we have the separating or adhesions kind of idea.
Yeah. And the more I kind of like looked at the physics of this process and the physiology of it, and looking at individual muscle fiber size compared to the capability of applying more specific pressure to individual fibers, it really, I changed my perspective a lot. And right now, I'll just say right now, because things again could change somewhere later down the road, but I just don't think we can do that. I don't think when we press through layers of skin, subcutaneous fascia, fatty tissue, and all that kind of stuff, by the time we get down to those fibers, the pressure is dispersed across a larger area compared to the size of those individual fibers. I just don't think we can spread them apart and broaden them. Now, that has not changed the effectiveness of those techniques in getting results with people. And I think those results are probably for different reasons, a variety of different reasons. But I no longer stick to that narrative of broadening and separating fibers, or doing this to separate fibers with deep friction treatments and things like that.
All right. No, that's very specific. And I think you kind of probably gave away the takeaway from most of these for me too, which is that, well, maybe they're effective, but maybe not for the reasons we thought. At least that's the theme these days, I know, for the last decade or whatever it's been in our field, but also in my work. And so there's an example. You're not thinking that you're physically spreading out the tissue anymore, or affecting individual muscle fibers in the same way. But so that your perspective changed. Did that change your work?
I still tend to do a lot of those same things the same way for certain types of things that I'm working on, because they got good results. And that kind of brings up, another question that gets asked a lot, well, does it really matter then? I mean, does it even matter if you're still doing the same thing, and getting good results? Like, why does this matter? And I would call people's attention also to a really good blog post that Todd Hargrove did a number of years ago. And I think it was titled something like "Why It Matters What We're Doing," or what happens, and he was advocating for, we've changed a lot of perspectives and we might still be doing some of the same things, but it actually does matter for us to understand why we're doing this or what happens. And that's, primarily because we might come up with erroneous assumptions that get applied to some other thing that are, not correct about what we're doing, or we're explaining things incorrectly to people. And just, being accurate does in fact matter. It might lead us astray down to make other decisions somewhere down the road that are just not as accurate.
We'll put a link to Todd's. You said it was a podcast or was it an article?
It was a blog post, if I remember correctly.
Yeah. Yeah, we had him as a guest
here,
but I remember that one he did. And I sure am familiar with the discussion. So thank you for that great encapsulation of it.
Yeah.
Any more to say about that?
And no, that's kind of like that would be a good example of something, refined perspective and change some of those things on my list there. So what's something on your list that comes
Well,
up
I got
for
a number of those, and you were very specific anatomically. I'm probably going to be more general, and just I'll get into my comparable one. But before I do that, I want to say I actually drew a blank when you asked me this question, which was weird because I think a lot of my teaching in this last 10 years has been about going back and revisioning what I was teaching before. And for example, these old recordings, you and I were just talking about that. We have recordings of ourselves, me from the 90s, teaching in a golf shirt.
Mm-hmm.
And those are still in the market. People are still buying and watching and writing in about those. From amazing to me, still complimenting them. But it was really awkward, I could say, for me to realize that what I'm saying now is very different in my mind, in my ears, to what I was saying then.
Yeah.
And so to have that out there puts me in a funny position.
Do you see instances where what you're talking about now actually contradicts those things, or has it just sort of changed a little bit direction, or
both? Yeah, both. Some of us, like you said, a lot of the techniques are still effective. Maybe my explanation is different, but there's things I've completely changed. And that's why I went to my faculty and said, okay, you guys, what would you say that you've seen me change? Because we've been working together for many years.
Mm-hmm.
And the first thing, of course, that came back was very similar. Do we release, in quotes, fascia?
Mm-hmm.
And that was the model I was trained in, that it was about fascial change. The change in people's posture, position, experience even, were explained by the mechanism of fascial change. And it turns out we maybe didn't understand as much about fascial change as we thought we did. And then what are the changes that our work produces? And we've done so many episodes about this, I don't need to try to recapitulate that. But basically that my perspective reversal has been from trying to change the tissue to produce a good result to just trying to produce a good result.
Mm-hmm.
And really looking at what defines that for the client and for me, and getting as honed in or as direct and clear about that result as I can, as opposed to trying to work through the medium of tissue, for example, since tissue isn't quite as the same as we understood it when I trained.
Mm-hmm.
Yeah.
Yeah. And so in doing that, has that also changed like perspectives of what you do clinically and working with people about,
yes,
for example, thinking about fascial work, do you still think along the lines of that tissue as something you're targeting, or do you think more along the lines of like, I want to help get this person, let's say, moving better or moving more in their body or whatever?
I think it's really raised the role of the subjective report of the client. Is the short answer. I do some of what you're saying, but rather than me doing a passive assessment of their posture, like I was trained as a Rolfer, or even their movement, as I was also trained as a Rolfer or Rolfing movement practitioner, I'll do a very detailed conversation. It's not that complex. It's just mostly I want to understand, what are they bothered by? What are they disturbed by? What are they motivated by? Why are they coming to see me? There's some issue they're wanting to address. I want to really understand it from their point of view. I want to understand how they know they even have something they want to deal with.
Yeah, right.
And then that helps me define the domain. Sometimes it's rare, but sometimes people come and says, yeah, my deep cervical fascia on my left side is just feeling a little overconnected with my thoracolumbar region, but that's pretty rare.
Yeah.
So I'm more like, okay, so how do it's harder to turn my head, and it hurts. I feel a funny thing right here, so I work more on that level now.
Yeah.
And I am using some of the same, techniques that are shown in those videos, but I'm also doing a lot more, I would say, inside out work with the clients, where I'm really getting them to, in a simple way, report on their experience and play with movement options and things like that while they're on the table.
Mm-hmm. Yeah. And I think, it's interesting. We probably all, to some degree, overemphasize what we think our clients really know or understand about what we're doing.
Yeah.
And probably it's not as complex and deep as we might think it is in terms of their perspective about, well, you're doing this kind of work and getting this kind of result with me,
No, it's great to educate clients. It's so fun when someone's interested and I can just kind of prattle away about my geeky stuff.
Mm-hmm.
But I actually, as much as I can, I want to work from my hands and from the present moment experience and from their inside out experience too. So it's gone from being a tissue technician to being more of a experienced technician or artist or something like that,
Yeah. I like that. Yeah. That sounds good.
What's okay? What else you got?
Well, I would say I would kind of like take off from where you started right there and just say, along a similar line, a very similar kind of perspective shift. Also getting back to the whole thing of posture and structure for me has changed a lot. A lot of the way that I did early training and focused a lot on stuff that I had learned, early studying, postural analysis through NMT and, working in the field of orthopedics for quite a number of years. I would look at certain types of things with, a postural evaluation, say, okay, this individual has an anterior pelvic tilt. So obviously we need to work on those tissues that are hypertonic and creating that, and then get them to shorten. And then that's going to correct this person's posture and we'll get them, changed and fixed.
Crossed, lower crossed, as well as so many. Yeah, there's so many models there.
Exactly. And so, I think the more the time is going, and what was interesting, I was thinking about this, there were some instances in which, I remember coming across some techniques, and this came back in, I'm thinking maybe like late 1990s, perhaps, when I was doing a bunch of research for my orthopedic massage book and was studying a lot of the stuff that was currently out there from other practitioners, teachers about how to do things like, how to fix an anterior pelvic tilt or how to fix a lateral pelvic tilt.
Right.
And some of the techniques and things that some people were advocating, I thought, this must be right because this person's a well-known authority and, they must have done all this stuff and had this work, but it just doesn't, I'm not sure. I believe that would really make those changes, but I kind of went down that road anyway and sort of said, well, it must be working because they must be getting results doing this. And I think
you had a wondering or a doubt, but you went with it.
And that's one of those confirmation biases of appealing to authority, of just saying like, well, so-and-so is an expert. They must know that this works correctly or something. But I think over time, I've really become much more accepting of the fact that, these are models that are sometimes created out of something as simple as structural mechanics or physics. And it would make sense, but that ain't how the body works, and that's just, for example, those kinds of things, just simply working on those tissues does not necessarily magically fix somebody's posture to make it be correct in a way that's going to stay there and that this fix really did it to them. I'm not so sold on that.
You don't think that's just because you never got good enough at it?
That could be. I should enter that as a possibility. That's definitely one of the possibilities there. So,
because that's often the critique that if we don't see radical posture change, it's just because we haven't evolved enough as practitioners or whatever it is.
Yeah. And I think the thing that sort of led me away from that, because, certainly, I mean, that's part of like a whole imposter syndrome thing. Like, well, maybe that's really true. Maybe it's just like, I'm just not good enough at it. But I think the thing that kind of led me away from putting a whole lot of coins in that basket was studying more about motor learning and recognizing that you can do some things. And, people love to do these little postural, treatment things and put people up in front of the classroom and, make things change and do all this kind of stuff.
Yes.
Have you ever seen Andreo Spina's video about the easily fooled nervous system?
It doesn't ring a bell. No, tell us about it.
We got to put this in the show links and also just have you take a look at this wonderful demonstration video called I believe if I remember the name correctly, the easily fooled nervous system. And it's done by Andreo Spina, who, and if I remember correctly, I believe he's a chiropractor and, movement specialist, brilliant guy. And he does this demonstration of just showing This is something that happens all the time in, workshops and training programs. You get a student to come up in front of the class and you do some kind of movement thing with them and you look at them and then you do this little treatment thing and all of a sudden they're, dramatically better. And he does this little demonstration where he's trying to show improving this guy's hamstring length. And he does some little thing to his leg and he gets greater range of motion. And then he does something to one of the audience members and then comes back and looks at this guy and his range of motion is improved, by not even working on that person, by doing something to somebody else in the audience. And the whole...
Oh, that's because our fascia is all interconnected.
Oh, there's our fascial connection. Yes. And of course, the Star Trekky fans will say, well, there's the board connection right there of everything is connected to the higher mind, right, through fascial connections. So between individuals. So, but yeah, the point is that in that particular instance, and we love to, what I was trying to get back to is like in the treatment room, we'll do this in a workshop or a classroom position where we, put somebody up and we love to see that immediate change and think, wow, this is great. Yeah. My work did this. But there's all kinds of things wrapped up in that having to do with expectation and, the being up in front of the classroom. And like, of course you want to see those changes happen. So you're going to make certain things happen to the nervous system that allow it to occur. But, in many of these instances, a lot of this stuff will happen. You'll think, oh, like, wow, I did great work here. But then, tomorrow morning or at the end of the day, when the person, gets home after driving home from their massage treatment on the freeway and getting all wound up in the car from, road rage, you've lost that, And so a lot of this, I think, is, to me, a lot more related to motor learning and retraining the body how to move than it is what I did with my hands that fixed that, so to speak.
So your perspective reversal was from postural analysis and postural correction to motor learning, you said, which explains those things that you're seeing in that video.
Yeah, I think that is a greater percentage of what's happening, and a greater percentage of the changes that I think we see in some people have to do a lot more with, impacting, like we've talked about before, proprioception, awareness, interoception, those things that really change our sense of how we feel and how we move and how we are in our bodies. I still think the role that we play as practitioners is crucially important because we are a facilitator for that change. But I kind of moved away from this idea that I'm doing something to people and making it fix, positionally, especially.
Nice. No, that's I think a lot of, even if people don't go through that exact transformation you spoke about, I think a lot of people, as they get more mastery and artistry, it becomes much less about fixing and treating and doing too.
Yeah.
And more about catalyzing, facilitating, encouraging some sort of shift on the other side of the table.
Right.
Well, can I share my... I
was going to say, what's next on your list there?
You make me think about the shift I made from posture and position and symmetrical alignment, which is what I was trained in and valued a lot and got pretty good at analyzing. So from that point of view to a point of view that was much simpler and probably more pragmatic, and in the end, at least as effective, if not more. So I'm just thinking about my process of teaching how to work with scoliosis. And you and I did a whole episode on scoliosis where you helped me articulate that some, but with scoliosis in particular, it helped me to realize that my goal wasn't just to make people straight, that there were other things along the ways that were really helpful to the person. And then when I taught a class, when I put together a class on working with the sacroiliac joints, and especially intra-segmental pelvic dynamics, up slips, down slips, that kind of thing, which are postural descriptions, positional descriptions, it really challenged me to think through a rationale and a way of articulating it that made sense to me. Because I was trained in some pretty, complex ways of assessing bony landmarks and extrapolating the different positional anomalies or distortions was the word, I'm doing air quotes, around the pelvis. And yet I had to really step back and look and say, what seems to really make a difference to the person on the table? And my perspective reversal at that point was, it did seem to be either a shift in mobility and or a shift in the perception or the proprioceptive interoceptive perception.
Yeah. Would you say this is one of those instances possibly where, facts and, maybe research studies and things like that also helped shape that to some degree? Because, a lot of the studies that had come out in recent years have said there's just some pretty poor inter-rater reliability about position of landmarks in correlation with, pain and dysfunction kind of things.
That's right. Yeah. The idea that you can't put, a lineup, like a police lineup, whatever you call that. You get like 3 people with pain, 3 people without, put them in a lineup and have the experts through just visual analysis, pick out the people with pain based on position and things. You can't do it. It's just, no. And then more specifically, like specific assessments even don't even match up person to person or day to day with the same person.
Yeah.
So no, that wasn't the facts. That convinced me at that point. I found those facts later and was really validated in my confirmation bias that it was probably mobility and experience that was more impactful than position. But it was something that I was really questioning when I would really have to say, what do I see working and what fits for me? And then also, what can I teach? All those things were coming together to really help me make that reversal of that shift from just paying attention to alignment or symmetry to more of options for movement, which includes, by the way, the option not to move. So it isn't just the same as range of movement. It's really, do you have a full range of options of movement?
Yeah.
And the refining of proprioception, which is really a great return for me of hearkening back to I've talked about our early training or studied in psychology, the field of psychology. For me, early training of psychotherapy, which is really more of an awareness-based or process-based practice. And, I think there was a clash for me, and I've talked about it here before, so I'm trying to repeat the stories too much, but there was a clash for me coming out of the Rolf Institute in the 80s and then going to study with some of Ida Rolf's former students at that time, like Judith Aston or Don Johnson or Robert Hall, who were really taking what they learned with Ida Rolf and shifting it to a more functional approach or really questioning some of the ideals there. And it really mixed me up as a young practitioner.
Yeah.
Because to oversimplify it for sure, it was a shift away from a tissue-based or a result, optimal functioning approach to a more process-oriented awareness, unfolding the developing evolution of the organism approach. That's not to make it so black and white. For sure, my Rolfing background gave me that too. But maybe it's just as simple as at some point, and this is maybe 20 years in, it didn't make sense for me to try to push things into alignment anymore. And it didn't make sense for me to try to measure bony landmarks position and then assume that because the position was, in quotes, distorted, that was a problem. That was the reversal. And then I had to come up with a set of tools and principles that would help me as a practitioner and help my students continue to do the good they do.
And I think, some of those ideas are really highly seductive to many of us, especially, early on as we're beginning to find our way into these places. I remember this is probably 1989, maybe, going to a workshop or training program with a very prominent CE educator in the massage field who was talking about work they had done with a professional basketball team, and they were called in as some kind of consultant. And this individual was saying, well, they went to watch the team practice one day and were watching one particular player and said, this guy is going to have these particular injuries because I can see what's going on with his biomechanics. This is going to be a problem. And I thought, like, wow, that is awesome. I want to be able to do that.
Totally.
Because really get sucked into that idea.
Well,
took me many years, I think, to really get back to realizing that's pretty presumptuous in terms of predictive processing. And there's a lot of other factors in there that may or may not play out.
But just to be the devil's advocate for a second, it's not like posture is nothing. And especially at high levels of performance,
Yeah.
in a sports situation or something, I would never presume to go up against a trainer or coach or something that had that model and used it effectively. I can't say that they're wrong and I'm right at all.
Mm-hmm.
And there is, especially as you look at either really extreme levels of, say, scoliosis or really extreme levels of pelvic asymmetry, you do get more symptoms.
Yep.
But in the range of most people's scoliosis and most people's pelvic asymmetries, there's not a greater incidence of pain.
Yeah.
And probably the same is true of athletics too. At high levels of performance, then those little differences really do matter around in position, you could say, or, certainly form. But at the level that most of us work at in the bodywork practices and that I was working at, it was a really effective perspective reversal for me to start looking at the things I do now.
Yeah. Right.
And so that's also, you mentioned before something about accuracy, and we want the narratives to be as accurate as we can. I would not argue with that at all, except to say that I have given up, for myself at least, as a working hypothesis, I have given up trying to be accurate or truthful or even find out what's right, because it's such a movable target for me, and I do change my perspective. And so it's I think my current benchmark is what seems to be useful, but also, of course, what resonates, what feels right to me. And I acknowledge that as an emotional valence, as a valuation of that. It fits and feels right. It's not to say that that's confirms it, but that's to say that it helps me be more effective at it.
Yeah.
And then my test is it useful? Does it seem to help the client with what they're after as well?
Yeah. I think you hear a lot of people talking nowadays about the movement towards trying to be less wrong as kind of more of a goal than necessarily saying something like, well,
I want to be less right.
I want to be right.
I want to be less right and less wrong. I'm like doing the axis, 90-degree axis from that or something. I'm saying I'm not even gonna try to evaluate in terms of right and wrong. It's more like, does it seem to get good feedback from me and from my client?
Yeah. And
try not to presume anything else about it being whatever else.
Yeah. So sort of you're shooting for kind of a middle ground of more, if I think I heard you say this one time, something like more towards results oriented treatments and away from descriptive rationales of what you're doing and why you're doing necessarily.
Yeah.
Is that accurate?
That's nice. And I'm just thinking of Ida Rolf's quote of some apparent debate was going on, and she says, everybody stop trying to figure it out. Just go finger it out. Go finger it out. So it's just, it's the pragmatic approach of working with what we actually feel and what our clients actually feel. That very empirical based ground. It was the groundwork for science. It's the groundwork for science. And
sure. Yeah. Yeah. So good pieces there for sure. So, well, I was going to bring up another one here that
please.
I think both you and I probably, and almost, well, I won't say almost all, but a huge number of people throughout the whole world of musculoskeletal or manual therapy care have been sort of impacted by, and that's some of the more recent research and explorations of pain and pain science things. And so for me, that brought on a lot of big changes. Probably if you kind of boil it down to a few simple statements or a few simple concepts and ideas, recognizing, for example, that pain does not necessarily equal tissue damage, or there's not a direct correlation between the degree of pain someone feels and the degree of tissue damage that is present, or vice versa. That's
become one of the axioms of, say, the biopsychosocial approach.
Yeah, it certainly has. And like a number of things, I've also seen this get off track, in my opinion, by boiling this down to oversimplified concepts or perspectives. For example, I think, there was blog post that I saw, or something like a Facebook post or something like that, where I believe it was Diane Jacobs had sent this because, she's a major thought leader in this area. And lots of people have sort of glommed onto this statement and repeated it numerous times, of saying there's no correlation between the degree of tissue damage and the degree of pain. And to me, that really oversimplified the statement, because I don't think, well, certainly I can't get on board with saying there's no correlation, because if there was no correlation between the degree of tissue damage and the degree of pain, we may not need anesthesia for surgery or some in cases like that. So yeah, there's a correlation between tissue damage and pain in many cases. I think it would be accurate to say there is not always a correlation between the degree of tissue damage and the degree of pain. And to me, I'm comfortable with that statement. But
yes,
I think we have to be careful jumping too far into these things without being a little bit more specific about different types of situations. But the crux of the matter being that I always kind of went along the assumption that those two things were directly related, and I had to do something to the tissue damage and fix it in order to address and alleviate somebody's pain. And
that's really big. And I owe Diane Jacobs a debt of gratitude just for her indirect influence. I've never studied with her, her neuromodulation work, but just the thoughts that she's put out there. That one, it's not her thought. I think I first heard it from Lorimer Moseley in the when his I think it was Why Things Hurt video got popular, and this was a long time ago, but she really articulated that from a manual therapist point of view. And her other line that resonated for me at the time was we're way too mesodermal, and we need to think more ectodermally, and that made a lot of sense for the things I was thinking and putting together. But you're saying that can be taken to excess too. That can become its own dogma or its own absolutist point of view in a way that people can get carried away with.
Yeah. I think, there's certainly pendulum swings on all these kinds of things. And that whole, the whole pain science movement of going towards more biopsychosocial models and things like that has been really ground shifting for lots of us in ways that really helped us be more robust and comprehensive in our treatment approaches and things like that. But part of the problems from this also that come out of this is, sometimes the pendulum swings too far, or, there is some degree of, I heard somebody say this one time, and I think it might have been you or somebody else, but it was a really eloquent statement about, the potential problems of bad pain education with clients when we try to teach them about these things that we've learned, and we just really botch it up and we make the situation worse, because that can certainly happen as well.
No, that wasn't me, but I get it. It's true that we learn something that's radically reversed our perspective, and then to bring somebody else along is another order of magnitude in skillfulness and perspective.
Yeah.
But that idea that there is not necessarily, I think you said, a correlation between tissue damage and degree of pain is actually pretty liberating for a lot of people. A lot of people in pain, to really help to tease apart their assumptions about what's going on because they're hurt, and the possibilities that opens up for them, but also for us as therapists.
Yeah. And what's interesting about this too is that I see this sometimes also doing both things, is it can liberate a lot, like you said, liberate a lot of those kinds of things. And yet at the same time, there are also people who really adhere to that kind of model. And when you can't find something that's wrong with a particular tissue through an X-ray or an MRI or whatever it is,
physical finding,
get really frustrated because they want a reason that makes sense to their models or the conceptual ideas of why this hurts. And what can end up happening in some of those instances, and I've seen this occur before, is like you have some finding on a diagnostic test, like, a person with a disc herniation and extreme pain that they have in their back and down their leg or whatever.
Yep.
And that may or may not be the cause of it. But once they see that, or once some health professional sees that thing, it gets blamed for that stuff when it may or may not be the case. And sometimes people really want to have a reason for what that is. And they'll really put a lot of eggs in that basket, which, can be helpful, but it can also potentially be problematic for
well, especially when there is something like a disc bulge that has a poor correlation overall. There's definitely people that have disc bulges that is what is hurting them.
Yeah,
definitely. But like you said, if we latch onto that as the explanation, that might limit our possibilities or influence our treatment choices. On the other hand, I don't know why I'm doing this devil's advocate thing. There's a special kind of purgatory reserved for those who don't have a diagnosis and can't get one too. So to not know why I have something going on is also pretty awful sometimes.
Absolutely.
Yeah. And it's pretty human. It can be really actually relieving to have an explanation that seems to at least explain it, if not offer some ways out. But then, and then we get into the other downfall, which is getting too attached to that explanation so that we miss some of the possibilities.
Yeah. And I think, we need to, and this is, kind of some of the things you and I have talked about before, and certainly one of the areas where, your background in studying things like, understanding a little bit more about relationships and communication in the therapeutic environment through your work in the psychotherapy world is so valuable, because we're not really trained well in how to manage some of those kinds of things, of those relationship things, or the challenges, perspectives that people come up with when we try to sometimes impose a model that we have on people, and we're not really listening to what it is that they're looking for and what's going to be therapeutically beneficial for them. And
whether
that's
it's
where
postural analysis or doing pain science or whatever it is.
Yeah.
That was a good point.
Yeah, those kinds of things become much more finessed fine points of good clinicianship, so to speak.
That's right. That's right.
Yeah. Well, what else have you got? Yeah.
Well,
any other?
I do have one or two more. I got a whole list, but one or two more I could pull out. This is a pretty arcane one, but this is basically the question of, are we stimulating a parasympathetic response when we work with the sacrum? I like it because it's so geeky and so specific. But basically, the model has been is that the parasympathetic nervous system has a whole group of sacral nerves, and that it's also concentrated up in your neck and the cranial nerves. So that there's two main centers of parasympathetic nerve exiting: the cranial cervical group, which includes the vagus nerve, and a sacral group, which includes the ganglion impar and some other structures, which were this idea. Those are the two centers of parasympathetic response, and parasympathetic being the relaxation and healing response that we think we're evoking when we do body work, and explains a lot of its benefits. This was basically the rationale behind cranial sacral work, cranium sacrum being the two centers of parasympathetic nerves, purportedly, as well as lots of other trauma therapies like TRE and things like that, that assumed that the sacral nerves were parasympathetic and so untraumatizing, relaxing the nervous system. There was a very careful research project a few years ago, and I'll put a reference in the show notes too, that analyzed the molecular structure of these nerves and compared them throughout the spine, and came to the pretty clear conclusion that the sacral nerves were sympathetic rather than parasympathetic.
Interesting.
Yeah. And that caused a stir in some of the neuroscience community, saying, wow, this is really bizarre that we can assume we know the structure of the autonomic nervous system for so long, and all of a sudden have a whole branch of it get reclassified. But it was fascinating to me in this question that we're talking about, like, how can we think we're doing something for so long and have an explanation that, again, more detailed research uncovers as being different. And I wrote it up for Massage and Bodywork, so I'll put a link in that to the show notes. But I chose it because, well, my faculty suggested it. They said that's one of the places you changed your mind. And it was questioning dogma at the time, but it was an interesting place where I actually got some pushback that I didn't expect either. And I should have, because every one of these reversals we've talked about has offended somebody, I think, or caused some kind of disbelief or challenge from people that know me, I think, and maybe lost me some friends. I don't know. But this one in particular, I got some really specific pushback after I put that article out that said, well, sacral nerves probably aren't parasympathetic, actually, after all. To say, it was something like, I was really surprised at how quickly you repudiated Ida Rolf's teachings around this.
Mm-hmm.
And it really got me thinking about the role of, it's almost like a tension between preserving the wisdom of our lineage.
Yeah.
And what we do when we have different or conflicting information.
Mm-hmm.
And that's certainly an old story in the structural integration community. And I imagine, I don't know, I'd be curious about what you think, Whitney, if that appears in the massage community as well. But it was one of those moments when I go, okay, there's a whole lot more here than molecular types in the nerves. There's the implications of what that means for our work.
Yeah.
And my big takeaway was what you said in your first one, that, well, even if those sacral nerves are sympathetic, in other words, more associated classically with fight or flight mechanisms, so what? A pelvic lift still relaxes people and has been really shown to increase vagal tone and a bunch of parasympathetic effects. Does anybody but us geeks care?
Yeah, right. That's a good question. Yeah.
Yeah. I mean, you got me going. I want to do an episode now on sympathetic, parasympathetic classifications, because it turns out that whole concept was not empirical, was theoretical, and was based on never really validated with the effects of the nerves. It was based on presumed functions based on their location and appearance and things like that.
Yeah. And what a good illustration too of those things that would make sense theoretically that we think should happen, but have not really been sort of tested and confirmed to be the way it really is, or at least a better understanding of this being kind of like the way it is. So, yeah.
Well, my sacral technique still passed the test of usefulness, if not for accuracy. So it's just that I had to shift the thing I was telling my clients and myself and my students about why they seem to work.
Yeah. Yeah. So, well, you asked, as we kind of like get near wrapping up here, you had also asked a couple other questions for us to think about. And I'm curious to sort of touch base on that about, what kind of makes some of these things difficult, some of these role reversal or perspective reversals difficult or challenging. What, from your perspective, makes some of those more challenging or difficult sometimes?
Well, it's pretty difficult to reverse my perspective if I'm attached to being right about my old one.
Yeah.
And who isn't attached to being right about their perspective?
What is that quote from? I can't even remember who it's from, about like, it's very difficult to get somebody to change their perspective about something if their income depends on them not
Mark Twain.
Understand. Was that from Mark Twain?
Yeah.
Right.
If a man has to choose between an explanation that supports his livelihood or contradicts it, he's going to choose the one that supports it.
Yeah.
So it's
right.
Yeah. There's that. I think,
and the more you have invested into it, probably the stronger you'll hold on to those.
That's right.
Those ideas. Yeah.
I mean, there's a fun podcast I happened to listen to before you even proposed this topic the other day, Freakonomics: How to Change Your Mind, where he's basically talking about, he's interviewing a few interesting people about what makes it hard and the cost. Like, say you're in politics, changing your mind, it could haunt you your whole career.
Oh, yeah. Right.
To change to go from one position to the next. It's going to be something your opponents use against you.
Yeah. Have to, predict the shifting winds of where public perception is going to be about something, and like suddenly jump on the bandwagon with it,
Yeah.
Yeah. So, well, one of the other things that I noticed about this too, and this is, more of an issue, I think, probably for some of us who've been producing educational content, is that, you put stuff out there like in books or videos or whatever some time ago, and then something comes along and you change your perspective or ideas about that, and it's still out there. And, somebody pulls it up and quotes on it. Well, so-and-so believes this, Whitney believes this because he wrote it in this book. And so, once that's put out there for posterity, that's kind of hard sometimes too.
I still get that. One of my most fun during COVID projects, though, was going back to those old videos and doing a new commentary over them, almost like the director's cut, but in a more interesting way than that. Yeah. Where we actually got to go through and look at the old stuff as a way to look at how the field has changed, and I changed too. And then we did a series of classes on that. So that was a way that I made lemonade out of all those lemons in my background.
Right. Yeah.
And then, just to put it again, devil's advocate here, certainly it's hard to change our perspective. And there's reasons why, especially if I have an investment in it, it's difficult. But I suppose the counterpoint to that is there can be, and I know we've seen this in the social media debates around the pain science stuff, is there can be a lot of value just on changing for changing's sake too.
Yeah.
Where there's certainly in the dialogue, there's certainly a role for the wisdom of things that might have turned into tradition, you can say, or the work that's gone before us, even if it doesn't stand the current test that we call, valid now. So there's certainly a role for preserving and honoring traditional wisdom or older forms of knowledge than we have right now too.
Yeah.
So it's such a paradox, such a tension between those 2 points of view, Orthodox and Reformed. That's been going on so many places for so long.
Yeah. So, well, those are some interesting things. Anything else you want to?
Yeah, I want to ask one more.
Okay, definitely.
Maybe it's just time for one, because I don't want to draw out the episode forever, but what's a reversal that you ask your students to consider?
I would say I ask them to consider every one that I present to them that have reversed things for me.
Yeah.
And I also simultaneously ask them to challenge me on those reversals of ideas. Things like, the things that we've talked about with, fascial elongation, like a lot of pushback on that because of narratives that have been around for a long time, or things like structural changes and, can we do those kinds of things? There's a fair amount of pushback on those kinds of things from students. And I always encourage the pushback because I think that's a valid means of developing clinical reasoning and developing, skills in, critical analysis and things like that. Lots of people are not comfortable with pushback from students on those kinds of things, but I actively encourage that because I think it's just really important for our, sharpening the sword of our minds and our analysis on things. So, but I do, encourage everybody to look at those things and all those things that I find for myself that are problematic or challenged or changed, ask them to look at those things too and tell me where they are with it.
That's great. No, I think I think my answer would be the same. It is those things that I've reversed on or shifted my position on that I enjoy bringing those up for students and either getting that mind blown light bulbs go on look or getting that furrowed brow. It's like, wait a minute, mister kind of look, either one of those gets me interested and I lean into those conversations as well.
Yeah, really for awesome. Sure. Good. So, well, we'll continue to change our minds, I would imagine, and continue to look at new and different ways that we can develop things. But hopefully the world doesn't change too much in the next little piece here while we finish up our places and things that we're doing. So anything else that you have before we wrap up today?
There's so much. This could go so many places, but that's a great place to wrap it up.
Yeah.
Let's see. I am doing the closing sponsor today. And that's a pleasure because the closing sponsor today is Handspring Publishing. And when I was looking for a publisher for a book I wanted to write, I was fortunate enough to have ended up with 2 offers, one from a large international media conglomerate and the other from Handspring, a small publisher in Scotland that's been run by 4 great people who love great books and who love our field. And by the way, we're going to have an episode with them coming up. I don't have the number quite yet, but we're going to get them on and actually let them tell their story. And they've had a really interesting one.
Yeah, fascinating story from them. We'll look forward to hearing that.
Anyway, I'm glad I chose them. And their catalog has emerged as one of the leading collections of professional level books written especially for body workers, movement teachers, and all professionals who use movement or touch to help patients achieve wellness.
And do remember, Handspring's Moved to Learn webinars are free 45-minute broadcast featuring the authors, including one that you have, Til. So head on over there to their website at handspringpublishing.com to check those out. And be sure to use the code TTP at checkout for a discount. And we thank you again very much, Handspring, for constantly supporting the Thinking Practitioner podcast. And we would like to say thank you to all of our sponsors. And also thank you to all of the listeners who've hung out with us here. You can stop by our sites for show notes, transcripts, and extras. You can find that over on my site at academyofclinicalmassage.com. And Til, where can people find that on yours?
advanced-trainings.com. If there are questions you have about what we've said, things you want to quibble about, lean into, mind-blown light bulb moments you want to share, or anything you want to hear us talk about, email us at info@thethinkingpractitioner.com or look for us on social media. And I want to say too, your reviews that you post on Apple Podcasts or the other places where you can review things, we read those as well. And they are so appreciated, so valued. So anyway, you can find me on social media at my name, Til Luca. How about you, Whitney?
Same thing. You can find me over on social media on my name, Whitney Lowe. And as Til mentioned, it is helpful if you will rate us on Apple Podcasts. It does help other people find the show. And you can hear us on a variety of platforms such as Spotify, Stitcher, Google Podcasts, or wherever else you happen to listen. Please do share the word, tell a friend so they can listen in on us with us too. And of course, if you're unable to find us in any of those locations, you can grab a vinyl copy of the Boston Philharmonic Orchestra doing a cover of My Sharona, and you can hear us on the flip side of that. So
with French horn accompaniment?
With French horn accompaniment, indeed.
Dang.
Yeah, absolutely. So that will wrap it up for us here today. And great to have you back, sir. Mr. Luca, welcome back. And
thanks for holding down the fort. Good to be back, and I'll look forward to more with you.
Yep, that sounds good. We'll see you all on the next go round.
Bye.